We really recommend skin checks for everybody across the board. Some of those skin checks can be with family members at home for people with lower risk factors, so infants, toddlers, individuals that are lower at risk. They may just do frequent home screenings, but in the office, if somebody has certain risk factors, we'll recommend once a year. Those risk factors consist of multiple moles, so if somebody has 50 or more nevi or moles, we'll typically recommend once yearly. If somebody has a personal or family history of skin cancer, we'll recommend once a year or more frequently. If somebody has really light complexion or tends to sunburn and has had a lot of sunburns, that individual is going to be a lot higher risk and should be seen once a year. The other individuals would be individuals with Parkinson's disease, childhood leukemia, and then individuals that are on immunosuppressants. So individuals that have had a transplant, whether it's heart, kidney, are at substantially higher risk of skin cancer. So typical screening, we recommend tailoring it to the individual. So if somebody is more comfortable having one area examined than another, we'll tailor it to that particular approach. For most individuals, because we can get skin cancer anywhere on the body, the recommendation is to have all skin surfaces examined. But I have some patients that feel a lot more comfortable having waist-up exams or even neck-up exams, and we'd much rather have somebody comfortable in having some of their body areas checked than not get checked at all. We see higher rates of skin cancer being reported over the last several years, especially in younger age groups that often we don't think about cancer developing. And so it's absolutely critical to get your skin examined early and to detect those skin cancers before they have a chance to metastasize. Skin cancer, especially melanoma, is very life-threatening if it's had a chance to metastasize, but if we can catch it before it's had the chance to metastasize, it's a simple surgical excision. We generally recommend sun protection measures, including sunscreen use. The recommendation is to use SPF 30 or higher sunscreen. And there's a substantial drop-off in terms of efficacy of SPF lower than 30. Zinc or titanium-based sunscreens are also much more effective than the chemical-based. And in general, we feel better about the safety of those physical blockers like zinc and titanium. Sun protective measures like sun shirts, sun hats, things like that have really grown in popularity the last few years, and there's even rating systems for some of those sun protective clothing. And then those sun protective measures are most critical in the hours of 10 to 4 when we're going to see the most intense sun exposure. Fall, winter, summer, all parts of the year we recommend SPF 30 or higher sunscreen just applied in the morning before you go about your day. Even just the simple walk out to your car or a simple walk into the grocery store, that cumulative exposure to ultraviolet radiation over the course of many years does make a huge difference in terms of aging effects and in terms of skin cancer risk. We see that cumulatively, we see a lot of sun exposure just from those daily activities where we're only going to be out 5 to 10 minutes at a time. Other important skin cancer tips are to avoid tanning beds. We see actually a higher risk of skin cancer from tanning bed use than we do lung cancer from smoking. And so it's really particularly critical to really never tan, even if it's going on a vacation, to get a base tan. Those infrequent incidences of tanning can substantially increase our risk. And when it comes to looking for spots, we want you to look for deeply, densely pigmented growth and growths that are rapidly evolving. About a quarter of melanomas arise from existing moles, and so moles that start to change that you've had for many years, or the other 75% come from arise as new spots. So new growths that are pigmented densely really should be monitored and evaluated right away. So those really dark, densely pigmented, and the multiple shades. If there's a light brown, dark black, the mixture of shades is something that we really don't like to see with pigmented growths. If we often refer to it as the ugly duckling sign. If there's one that looks way different from the rest of your moles, that's one that you should let your primary care physician or dermatologist know about. If it does have concerning features, we typically will do an initial biopsy to get a diagnosis, and that biopsy involves numbing the area first and then cutting down into the skin and removing and extracting it out, and usually putting 1 or 2 or 3 stitches in there. Once we have a formal diagnosis, depending on the depth of it, it can get a lot more complex. If it's very deep, then it's sent to the lymph node testing, larger excision, sometimes radiation, chemotherapy. If it's very thin, it's an additional excision removal surgically, and that's it. So we see such better outcomes and so much less cost to be able to detect something early than if we discover it late.